When a patient arrives at the emergency department, the first thing they need to do is see the triage nurse. If you walk in, you take a ticket and wait to see the triage nurse. If you come by ambulance, you get brought through and the triage nurse comes to see you.
So triage is a priority-based system, so it's a 1 to 5 system, with 1s being our need to be seen immediately.
We see the most medically urgent patients first.
If someone feels worse while they're waiting to be seen, we encourage them to speak up. And are you of Aboriginal or Torres Strait Islander descent?
Aboriginal.
Identifying as an Aboriginal person or a Torres Strait Islander person is really, really important right at that beginning stage. They then are offered the opportunity to have our team come and visit them.
With the Aboriginal health team, we advocate a lot on behalf of our patients, especially if some are in intensive care. It's important that we get their next of kin, so we can advocate on behalf of the family, because the patient is incapable of doing anything for themselves. Especially the ones that come down from the communities, which their English is their third language. So we have to advocate for them as well.
So if they approach the Aboriginal health team and they say their preference is to see a male or female, we make sure that happens, because we do have male and females on our Aboriginal health team.
After that, you get brought through into the emergency department into what we call an assessment space, and depending on how unwell you are, you'll be brought through to different areas of the emergency department. They will ask you some questions about why you're here, what your problems are, what you're concerned about, and then examine you to try and work out what is going on. After that, they'll make a decision about what investigations we may need to do. So this could be some blood tests, x-rays or a CT scan or an ultrasound. It might be that they want a specialist team of doctors or nurses to come and see you. We have a mental health team, for instance, that might come and see you, or the inpatient medical doctors or surgical doctors or the bone doctors. After all the investigations are done and we've got those results back, which can take an hour or so sometimes, we can then work forward on what's the plan from here. So one of 3 things will happen. You'll be safe to go home with a follow-up plan. You may need to come into our hospital, or if your problem is something that we don't have the speciality to manage that problem at our hospital, we may transfer you to Royal Perth or Fiona Stanley Hospital.
Before they leave the hospital, we actually do a discharge plan. They may need transport to certain medical appointments. We can assist them by contacting the interagencies and getting the support services put in place.